Hello everybody, I am Dr. Senthil Kamalasekaran, Senior Consultant at Chennai Ortho Clinic, and today I am going to talk to you about trigger finger or a locked finger which cannot extend. Basically, this condition affects people who are into lot of work with their hands. It's an overuse problem, and many people usually land up with pain in the bottom of the fingers, which is secondary to an inflammation in the tendons, which we call the flexor tendons, which help to bend the fingers. So sometimes what happens is when the finger is bent, you find it difficult to straighten it. And when it straightens with a pop. This snapping finger is called trigger finger. It usually comes with overuse, but very rarely it can come over a period of time, especially if the person has symptoms of diabetes, affected with multiple joint problems like rheumatoid arthritis, or if they have any features of thyroid problems, where there is an increase in the fluid in the region of the tendon. However, treatment for this can be varied. We normally start off with investigating the process. We do investigations like ultrasound examination of the tendon sheath. We also do an MRI to see if there's any kind of problems in the region of the tendon. If we find out that you have a problem in the flexor tendon, which can be affected because of the inflammation, and there is problem with the gliding, due to which we call it as a problem of triggering, then what we normally suggest the patient is to have a course of physiotherapy, in which we put them through modalities to help to bring down the inflammation. We also put them through a course of stretches and exercises to help their hand regain the function. If it does not work, then we also put them on a course of pain medications or anti-inflammatory drugs, which will bring down the inflammation in the tendon sheath. If this does not work, sometimes we opt for injections to relieve the inflammation in the tendon sheath. In the last case scenario, in which these modalities do not give the patient benefit, then we opt for a small procedure called a A1 pulley release, in which the small tunnel through which the tendon passes and is getting stuck, we release the roof of it so that the tendon can glide freely. It is a daycare procedure, can be done under local anesthetic, completely safe, and most of the patients are able to go home the very same day. Usually after the surgery, the person has a couple of stitches in the base of the digit, and these are normally removed at around about 2 weeks. Patients will experience some minimal stiffness for a couple of weeks thereafter, and most of them can regain their hand function within a period of weeks from the time of surgery. I hope you like this short video. If you like it, please do like, share and subscribe. Many thanks.